Department Health Officer, Rashmi Travis. Rashmi, welcome back.
Thank you. Good afternoon. Glad to be here.
And we learned just before the show, I learned that Rashmi has 9-year-old twin boys. That has got to be a challenge.
It is. It is. My first job, really, right? Motherhood.
Right. So they're home all day, obviously, no school. So what's your house like?
Sure. Chaotic is probably the best word to describe it, but it's great to have that family time as well. So.
They entertain each other?
And they do, as well as myself and my husband.
Okay,
Yeah.
good. Well, today we continue to see great news from the health department as the number of cases just very, very slightly increasing each day.
Correct.
And we've had no new deaths for over a week.
Right. Yes.
What's the trend show you?
So it is good news, as you mentioned, Bart. I think cases have been increasing a few at a time versus the 20 or so that we would have at any given point in time in terms of positives. The deaths that we are seeing on our website that we posted, 26 deaths, as you mentioned earlier, haven't changed. Also good news. A third of those deaths have occurred in the nursing homes, so we keep a close eye on them and provide them assistance in terms of infection control practices, community mitigation practices. I think the other thing to note is also reporting that most who have died have been between the ages of 55 and 99, really, so the younger age groups not seeing deaths there, and really still amongst the older age groups is where the deaths are occurring. And then also we break down by minorities groups. We have 2 minority groups that are represented within the death data as well.
And what does that show? Because in Detroit there was a big concern that the numbers were disproportionately showing the effect on African Americans.
Yes. So that's a great question. In Jackson County overall, 13% of the African American population represents our county as a whole. And understanding that they are also, there's disparities involved there with health issues, chronic disease issues, things like that. They may also be experiencing socioeconomic issues, whether it's housing or having running water or things like that. So when we say wash our hands, to us it probably means nothing, but to some it might mean something. And the neighborhoods they might be living in might be a factor as well. At the households, it might be multiple individuals living in a household. So those are all certainly things that impact a certain culture, a certain race that we try to assist and provide, educational information geared toward them.
Well, today, for the first time, Rashmi was able to share with us the locations in Jackson County where the cases have been occurring.
We have, yeah. So I appreciate you putting that map up, and thanks so much to our clinical services coordinator, Jennifer McCumber, as well as our GIS department, Scott Ames and Nathan Pinty, who have worked hard to put this all together for us. So the data you will see is a couple days old. We have 400, this is based on 414 positives. We are up to the 421, as you mentioned. These are by addresses, Bart. So you might have a couple that aren't in here because they are P.O. boxes, and certainly you can't represent them that way. So what they were able to do is really take it by zip code. And then those dots represent, as you can see on the legend there, cases. And it's just an easier way to group that together. There's really no relationship there, like not one specific event or something like that. But you can at least see visually where are the cases occurring in our county and where are those, sort of clusters happening in the high density areas, things like that.
And we're seeing most of the cases in Jackson, Summit, and Blackman.
Correct. Yep. And then we also have another map that we've been able to provide thank you, for by township. So this is useful, and as you just mentioned, Jackson City, Blackman, and then Summit townships there as well. Being by color-wise, you can see there where the higher concentration of cases are occurring. Not surprising, knowing that high-density areas where people are, might be more in close quarters, things like that. So the city numbers aren't really all that surprising. But pictorially, at least, this gives you where, and then, even our elected officials can go back and say, hey, here's what's happening in my area and where you live, things like that.
So virtually every township and the city of Jackson affected in Jackson County.
Correct.
see Blackman with 70 cases. These are people's homes that are the stats are based on.
Right.
So is there a correlation between the prison and Blackman Township numbers?
Sure. So we report out is the prison, the MDOC employees, Michigan Department of Correction employee numbers are included within those figures you just saw. Prisoners are reported on the state side, given they have regulations and rules for reporting that out. So, we certainly are able to pull our data and pull, if we want, say these are the MDOC employees impacted, but they are included in that Blackman number as well, some employees. So, we do try to, we do our best to educate the prisons and help them understand the importance of community mitigation strategies there.
And with the numbers, the 421 today, we do know, or you do have an idea of how many of those are prison employees?
I think for the last time I saw in one of my communications, Bart, I think it was May 8th, we had I believe it was 30 something that we had as far as MDOC employees. I don't have the exact figure with me, but we tried understanding that, they have offered testing at the prison voluntarily. So there's that could potentially increase our numbers at some point. Those results are pending still. So it might be, probably as high as that, but I don't have that exact figure with me, sorry.
Well, with all the other numbers that you have, particularly with the positive cases throughout Jackson County, do we know anything more about the cases? As an example, are there essential workers, aside from the prison staff, obviously, but are there other essential workers that are part of the positive cases?
Sure. So we have been doing a great job in terms of helping our first responders, fire, police, EMS, and they're considered our essential workers, particularly in the county. Not very many positives there, I have to say, though. And I think they have been trying, being vigilant about testing and also, being aware that that's something offered to them. Center for Family Health has 3 locations. Henry Ford has their drive-through location, conveniently those hours and times, I'm sure with their shifts and things like that, it makes it somewhat challenging. However, I know Henry Ford Allegiance Health Occupational Health, has been gracious enough to, meet with them and talk with them about what are we looking at in terms of your shifts and how can we work with the groups that you have. Also have to look some level at the medium and risk levels, right? Medium on high risk. If I'm a cop that goes out on the road, road patrol, and I'm facing you as somebody I just pulled over, that's certainly a higher risk possibly than somebody who's working in the office doing administrative work. So that might be some of why we're not seeing the numbers as high in terms of contact that people are having.
I would say that as a whole, this is good news. What we're seeing geographically, but also the numbers.
Sure.
With 158,000 people in Jackson County, I think we're doing a good job.
We are, yeah, and I appreciate you pointing that out. I think we've been wonderful about testing, as I mentioned, our 2 places, Center for Family Health and Henry Ford. We really have been on the forefront with getting out there and doing testing, and trying to make people aware testing is important, know where you're at and that kind of thing. So.
And here in Jackson County, we have better access to testing than many other counties. And
absolutely. And speaking with my counterparts, we're great to have this healthcare system right next door to us and being, super helpful and cooperative, as well as Center for Family Health. So that's been a blessing.
Are people still getting tested? Last time we heard from Center for Family Health, 50 to 80 people a day. Is that still valid?
Yeah, I think one thing that we will need to continue to try to promote is the importance of testing, and you might see some of that waning over the course of the next few days. Some of it might be the weather's getting better, what people's priorities, family time, things like that. So, but truly, the state is also pushing a neighborhood testing. They have this initiative called a moonshot testing, which our county, again, probably because we were testing proactively, hadn't been asked to do that. But neighboring to us, Lansing, there's some other areas. I think Battle Creek might be another, but there's several areas that are considered in this moonshot initiative, meaning the state has this goal of how many tests they want to do by a certain date, and they're surpassing those numbers now, which is great to hear. But we got to keep up the momentum and keep the education going on that.
And I think that's a concern of everybody, that when the weather gets warmer and it's vacation summer, it's going to be tempting to let our guard down.
Yeah, absolutely. So it's our job, I think, there to educate folks and, try to keep people complacent with what we've been doing and keeping on that right track.
And one thing that you're doing is helping employers and employees to be educated on how to have a safe workplace.
Sure.
And I think it's been confusing because the CDC has put out a 61-page instruction manual, and man, it's thorough, but it's confusing.
It is, yeah, it can be. And we certainly utilize the CDC and OSHA for our guidance, in the development of this. So what this is essentially is our COVID-19 workplace toolkit, our business toolkit, if you will. We took what the CDC had and, great layout there, but how do you Jacksonize it? How do you make it useful for our businesses? Understanding all the manufacturing places, all the small town businesses we have, things like that. In this toolkit, just to give you a run through of what it includes, this is our cover page, but within it, the contents include, just a layout of the executive orders, just mentioning what they are there, links to those. It also has questions, like frequently asked questions, like what do I do if my coworker starts exhibiting symptoms? What do I do there? It's supposed to be an easy layout there, and then it goes into a screening form. This is probably one of the most critical areas of it, in that the screening form is intended to, I work at the Bart Holly show. As I come into the door, please, take my temperature, ask me if I have symptoms, things like that. Businesses are doing this, and it's helping to reduce that, the rate of people spreading it within their office and workplaces, And it might be, it comes back to, and even one symptom, really, not fever alone, but sometimes one symptom alone could be an indicator, possible indicator of COVID. So it's critical there that employees are honest about what they're feeling and what's happening there. And it might be they hear the news, you got to go home, you can't be at work today. And that's unfortunate, but I think, we're trying to make this as accessible as possible. It also includes resources, how to wear your mask. I brought my surgical mask with me today, but also understanding a cloth face covering is just as good, but make sure you're laundering it. This is the easy place to sort of find that information. It's off of our Jackson County Health Department website. And we've sort of grouped this into like businesses, healthcare professionals, schools, in various groups that have specific information tied to them. So the business toolkit they'll find under the business resources. So essentially it's meant to be just a helpful resource, and just, utilize it any way you can, and just to keep yourself safe and your coworkers safe and your employees safe.
Yeah, we've seen nearly 100 executive orders, a lot of information to keep track of.
Yes, it is. Yeah.
And there's some that's not clear too. I
Sure.
think that some is subject to interpretation.
Yeah.
Have you struggled with that?
I think, in all honesty, Bart, I think we do. Even as health officers and public health professionals who know our jobs, understand the work we do, when you translate that to orders, if you will, or something coming down from the governor's office, you put it into that format. And when you say enforcement, when you say law enforcement helps you in this regard, prosecuting attorney, the health department, here's what you do. A lot of that, it turns into legalese when people see it, and that's hard for the general public to understand. I would love for, maybe that's something we can work on a future project, like just making it more like, user friendly and laying that all out. I mean, we got a lot of calls when the one about businesses shutting down, came out, and for good reason. I mean, people said, well, I've got this, I've got this in this shop. Does this really apply to me? I'm like, okay, well, I've never heard of something like that, but let's look into it. What do you do? How do you interact with your customers, your coworkers, things like that? Can you put up plexiglass, and still be customer friendly? Can you put tape on the floor 6 feet apart, and still be customer friendly? Maybe approaching someone with the mask, understanding the cultural things and things like that displays. Can you do that? So really, it's not meant to be critical of the way that things have been done or the businesses the way they've been doing it. It's more just can we help you do it better and more safer? So yes, I think those executive orders, getting back to that, can be difficult to understand. And reading through them and understanding, how does this impact me though?
Yeah, and really and I think everyone's case, from health officers up through and including the governor's office, it's all new. We've never dealt with anything like this before.
No, you're right. Absolutely. Yeah.
So social distancing, washing your hands, the recommendations on staying safe, they have not changed really at all.
Not at all. And, this is an excellent pictorial view too of like the same common sense things we've been saying all along, just reiterating it. What can you avoid? There's the red area. What can you keep your distance at? Take a little bit of cautionary tale there, The avoid areas seem pretty obvious. Any group gatherings, large people gathering together. You mentioned the parks earlier, trying to avoid tons of people talking at the bathroom or something like that, things like that. Keeping your distance, these are the things, the cautionary pieces. Like going to a restaurant might be okay, but maybe you won't have a neighbor sitting next to you while you're eating. It might be that way. Visiting a grocery store, those are the important things that you would still need to be doing, like getting your medications, things like that. Playing in the park's important. Physical activity, keeping your health up and immune system up there. But while doing all that, 6 feet apart, possibly wearing a mask, or face covering, excuse me. And then these are the green areas, the things that are pretty much safe to do. Taking a walk, pretty much on your own, going on a hike, playing in the yard. These could also be done within individuals in your household. Just sort of common sense things, but absolutely, like these are things we would do either we're at work or at home, really. I mean, at home it's a little different, again, being within the household, but going to work, going to the grocery store, maintaining those precautionary things are all critically important.
But they do apply to work too. Brandon, we do have permission to clean out the closets here at JTV.
Oh, I didn't know that. Okay, now we know. All right.
Yep. Yeah.
We're expecting probably sometime in June we'll see the governor lift restrictions like she has in the Upper Peninsula and the Traverse City region.
Yeah.
Restaurants, that's another area that's already under your watch.
Right. Mm-hmm.
Are you concerned because it looks like restaurants have to go through a lot. There's going to be expense. They've got to buy safety and cleaning equipment. They've got to retrain.
Yeah.
It's got to be for a restaurant. It's got to be just one thing on top of another.
It is, yeah, and and we love when those businesses get back into it and open it up to the public. But there might be a different way of looking at the way that they're doing that. It might mean you come up and you're ordering your meal or something, and there's plexiglass. And like I mentioned, there might be a neighbor not on either side of you. It is gonna look very different, and I think it's gonna be done in a methodical way. I think the UP and the Traverse City area are going to be somewhat, our indicators of this, if you will. We all are watching it closely and understanding what data was put into how did that happen. I mean, really, their numbers are pretty low compared to what we're dealing with, in terms of positives. So you think about it, yeah, of course you're going to start there. You're going to start in some of our tourist areas, which are obviously Traverse City, things like that. But we have our own businesses, and how they open up and how they look, are very different. But I'm hoping that Toolkit also provides some level of, plexiglass. We also have some links to resources of where you can get stuff, whether it's booty covers or gloves or mask or plexiglass or any of those kind of things. So it certainly will look different. And I think we've been fortunate. A lot of our business owners and establishments have been very cooperative in working with us. Even pre-COVID and post-COVID, or not post, I'd love to say post-COVID, but we're not there yet. Within COVID, working within those realms and having an understanding of that.
A lot of great news, a lot of great information too. Thank you, Rashmi.
You're welcome.
And thanks to everyone at the health department. I know you guys are working above and beyond in handling this crisis, and we appreciate it.
Thank you. Appreciate you having me.
Health Officer Rashmi Travis from the Jackson County Health Department. Returning to the show, our next guest, getting ready in the General Materials green